Greetings to all of you. I think that very slowly the room is filling in, and we're quite pleased to see that we have had a very high rate of registration. So it seems that the topic and the colleagues that will be discussing around diversity and equity in early childhood education and care is very high. I'm Mihaela Ionescu, Program Director in ISSA, and on behalf of OECD and ISSA, the co-hosts of this event, a warm welcome to this discussion about the connection between quality and diversity in early childhood education and care. This webinar will aim to bring forward the findings of the OECD Education Working Paper, Leveling the Play Field in Early Childhood Education and Care, the results from Starting Strong 2018, and its companion policy brief, which are pointing to some valuable insights regarding the relationship between diversity and quality in early childhood education and care. I will call it ECEC, which is shorter, and I think everybody is familiar with the term, and will provide also some useful policy pointers. The OECD publications look at the diversity of children attending ECEC services along 4 dimensions, and I think it's very important because in the presentation also we will touch upon this. The socioeconomic disadvantage, the special education needs, different first language, and refugee status, and how these dimensions, they correlate with selected structural and process quality indicators across 9 countries. In other words, the publication looks at the diversity and quality as key variables in the formula for achieving equity. But I suppose that everybody would agree it's a very complex equation, which requires further research and informed policy discussions and decisions, but also a deep understanding of the role and the place of ECEC in the broader early childhood ecosystem and how it contributes to equitable support for all children. The discussion today will touch upon 4 aspects. One is the relationship between diversity and resource allocation, material and human, like staff composition and preparation and experience. The relationship between the different dimensions of diversity, as I mentioned them, and staff practices with children and their attitudes in context of diversity, as well as the relationship between diversity and the engagement of ECEC services with families, communities, and other services. And then we will close with a more system view regarding the system's approach to diversity and its readiness to address it to ensure equitable support to all children. Well, it's a busy agenda, and I have to say, we are not even touching upon all the issues that are presented in the paper, so we have to really stick to the valuable time that we have all together spending this afternoon. And I have the pleasure to have with us today Andreas Schleicher, Director for Education and Skills Directorate at OECD. We have Alejandra Cortázar, Early Childhood Specialist at the Center for Early Childhood Studies in Chile and Senior Fellow at the Inter-American Dialogue, and Michel Vandenbroeck, Professor at the Ghent University, Head of the Department of Social Work and Social Pedagogy, the Faculty of Psychology and Educational Sciences. I'm so privileged to have all 3 of you today. Together, in this 1 hour and 15 minutes, we will have, just to briefly tell you how we are planning to spend our time together, we will have from Andreas Schleicher an overview of the main findings of the report. Then we will follow with 40 minutes panel discussion and followed by questions and answers. So feel free to put your questions in the chat section so that we can get back to them. And then we will conclude just with a few top view conclusions. So I'm mindful of the time we have, and I'm sure that everybody's interested to learn more about the findings of the policy brief. So without further ado, I'm inviting on the virtual floor, Andrea. Please, Andreas, illuminate us with the findings, and which I'm sure that are just going to trigger a lot of thinking and discussion. Thank you.
Thank you so much, Mihaela, and it's such a pleasure to join ISSA for the launch of this report. It's an exciting topic and a really difficult one. We all know that diversity in our societies is increasing, and it hits the early childhood education sector often soonest. So let me share, a few slides with you. The first point I really want to make is that it is the early years of childhood that hold that great promise to create a level playing field for people. Now, if you come from a wealthy background, you're always going to find open doors in life, whatever. But if you come from a disadvantaged background in particular, you often have just one single chance in life, and that is, find a great early childhood education and a school and a teacher. If you miss that boat, unfortunately, the odds are often stacked against you. We just need to realize that that is the context in which we are having this discussion. This is just crucially important. Now, I want to just, highlight one thing. We have done a survey on the early years among 5-year-olds, and that showed us really very large learning gaps already between socially disadvantaged and advantaged 5-year-olds. In both the cognitive dimension, you can see that here, emergent literacy and numeracy, but also very important social emotional aspects of development. Essentially, what you can see here is that children from disadvantaged families face an 8 to 20-month learning gap behind more privileged children. And as you can see as well, the gap is more pronounced in the learning gap on the social and emotional dimension that often gets less attention. So already children start out on a very uneven kind of level. And when you look at this among 15-year-olds, we have our PISA survey, you can see that those gaps are remarkably persistent. We must acknowledge that currently often, education is not doing much to moderate social inequalities. Sometimes it's reinforcing those kinds of gaps. Same is true in the early years. Often it's the privileged children who attend the better early childhood education and care facilities. So I think there's a lot to be done to create a more level playing field. It's the only chance that we have in our societies now. And, public policy can make a difference. This chart is more encouraging. The same data from our EL survey show that attending early childhood education and care is actually quite clearly linked to stronger cognitive development, and particularly so among disadvantaged children. You can see the green bars that represent disadvantaged children. They're much longer than the yellow bars for those from wealthy backgrounds. So early childhood education makes a difference. It can actually contribute to leveling the playing field. And of course, high quality early childhood experiences compared to average quality provision can result in much larger gains. But, early childhood education and care is not the only piece of this puzzle. And it also cannot work in isolation, even if of the highest quality. We know how important the links are between teachers and parents, and also the home learning environments in which children are. So we need to look at all of those aspects really together. And, let me show you some data from 15-year-olds. Now, this comes from our latest PISA study. What you can see here in countries with stronger family support, for example, where children, ask their children regularly about schoolwork. You see that here on the horizontal axis. Students generally also felt a stronger sense of belonging, a stronger sense of identity at school. That's the vertical axis. And they also did better in school subjects like mathematics. So that, family support, that connection between education and the home environment is really critically important now. And the quality of interactions with teachers matters as well. Again, on 15-year-olds, we can see that students who feel that their teachers were available when they needed help during the pandemic, they were more confident to learn on their own. Having that social connections with your teachers is, an inspirator for actually, self-directed learning. And where students felt, their teachers were accessible, available, they also scored roughly a school year better on the PISA test. And when we looked at that more closely, we found that countries where teacher support improved over the last years, they were also generally the countries where mathematics performance improved. Now, that was about 15-year-olds. Let's get back to the early years. You can see here that enrollment rates at age 3 to 5 are now pretty much, universal in OECD countries on average. Now, that's not universal, but pretty close to that. But that also means that questions around, how do we cope with an increasingly diverse body of children become just, increasingly important. And there's some really tough questions to address. The first, what's the prevalence of different dimensions of diversity among children in those settings? And to what extent do those dimensions of diversity concentrate, accumulate, which makes them harder to deal with, obviously? And how do indicators of structural quality and of process quality compare between more, affluent and less, or more or less diverse centers? Now, I think that's a really important question. Is there an interaction between diversity and the ways in which, structural and process variables interact with that? And that's really what these papers that we publish here are about. So let me just introduce, our Thales Strong survey, on which much of this work is based. It's an international survey of staff and center leaders, and it asks professionals about the working practices, the training, the job satisfaction, views about the sector as well. And we have data from 9 countries and 2 levels of education. We looked at pre-primary education, that's done in all countries, and then settings for children under the age of 3 in 4 countries. So that's basically the survey on which the data are based, and it looked at 4 dimensions of diversity of children: children from socioeconomically disadvantaged homes, children with special education needs, children with a different first language, and then children who are refugees. And Mihaela, you highlighted those dimensions already. And we looked at those in those different settings. Well, let me explain a little bit more about what we mean by structural quality. This is essentially the more, distal indicators of quality, the kind of things that we can influence more readily through public policy. Structural factors, are things like material resources, the number of staff per child, qualifications of staff, their training requirements, the working conditions, and all those kinds of things that are structural. And with process quality, we then get closer to the children. Essentially, this is about the quality of the interactions with other children, the quality of the interactions with adults, with the staff, the families, the environment. And we used basically 4 groups of indicators. We looked at the shortage of material, to what extent or how does that relate to diversity. We looked at the training on diversity topics. Now, on those 4 dimensions, we looked at pedagogical practice when it comes to process quality, and we looked at parental involvement. So let me highlight some of the results on this. What you can see on this table is that shortages of material resources are actually a lot more reported by centers that serve children, or that have a higher share of children from diverse backgrounds. That's troubling. Basically, what this means, you have more diversity in your center, you need more resources, you actually have less of that. And that's pretty consistent across the countries that you see here. Now, the figures in the yellow elements show you the difference in the percent of centers that report a shortage of material resources and those that do not. Now, so you take, for example, here Turkey. Now, that's the first one here. Centers with a higher concentration of disadvantage talk more often about shortage of resources. Centers with special needs have fewer resources, and the same with language. The more children there are with language needs, the fewer resources the center seems to have. And then, all of those things get, accumulated, concentrated, which makes them really, really difficult to deal with. So that's quite discouraging. Now, we are still quite far away from aligning resources with needs. Now, there is no country here where you can say basically there is a progressive allocation of resources. Resources are intentionally matched with needs, at least not among the countries for which we have data. But, here are some more positive findings. What you can see on this table is that training is actually quite responsive to diversity needs that centers face. So you can see here, only one element in yellow for Turkey, the others in blue. basically that means in many countries there's a quite deliberate effort to provide diversity training for teachers in disadvantaged centers. Special needs centers or centers with more different language provision. So, but basically what you can see here is those centers that have higher concentrations of diversity tend to recognize and invest more in training needs, which is obviously important to give staff the support they need to address those kinds of difficulties. And those results refer to whether staff had both pre-service and also in-service training on diversity topics. But I must say the results are quite driven by the training received in the last 12 months, which again speaks to a good match between training contents and the context in which staff work or the conditions in which they work. So at least you can see when it comes to training, the systems seem to be responsive to the diversity needs of centers. Here's another positive result. It looks at the prevalence of adaptive pedagogical practice in different types of centers. Again, what this shows is the responsiveness from staff to the profiles of children they work with. You can see there seems to be a greater level of adaptation to the needs of children among staff who work in more diverse classrooms, where there tends to be more variation in such needs. So in a way, you can say people tend to respond to the diversity in terms of adapting pedagogical practice, at least in the countries that you see marked here in blue. Let me conclude with a more challenging result. You can see again more yellow than blue. The table here shows that a smaller share of leaders of more diverse centers report that parents or guardians are involved in the center's activities, quite a bit or a lot. In one way, again, you would want to ensure that, when there is more diversity, more challenges, that teachers or parents become more actively engaged with the centers. But you see somehow the opposite pattern, that, again, some of the children that need that interaction most will get the least support, and interaction with the parents. And that, again, shows us how difficult it is actually is to engage parents and ensuring more alignment of experiences across early childhood centers and the home settings. There could be many reasons behind that. It could be limited resources on the side of families. People have no time, but it could also relate to maybe a lack of deliberate intentional strategies or the instruments of central leaders and staff to find the families, to reach out to them, and to talk to them when they come, for example, from a different linguistic background. So there could be lots of barriers, that relate to the families, but there could also be barriers that actually relate to the centers and need to be addressed by them. So you have seen how much of the aspects that define quality in early childhood education and care vary between centers with higher and lower shares of children from diverse backgrounds. So in some ways positive, in others quite troubling and negative. But the associations between the diversity of children's populations and structural and process qualities are complex, and they also differ from country to country. You could see, some countries had yellow markers, others blue. So their relationship also varies, and that suggests, we can do something about it, and countries interact with those issues in different ways. Quality generally responds positively to diversity staff regarding staff special roles and their training profiles. You could see that in the second chart. The use of adaptive pedagogical practice with children as well. You could see many centers making a deliberate effort, and the frequencies of centers' cooperation with support services. And across countries, those indicators point towards generally higher quality in centers or groups with higher shares of diverse children. And I think this is a very, encouraging, very positive finding. Where you find more diversity, you generally also see that there is a more, effort, except for, the quantity of resources now. By contrast, in the majority of countries, other drivers of quality, such as the adequacy of material resources and the levels of family engagement, they tend to be lower in more diverse centers, as you could see in the first and the last chart of this. And Perhaps unsurprisingly, variation of quality with respect to diversity is higher in those countries where overall levels of social and cultural diversity are also higher. Now, that's what you would expect. So what can we do? It's going to continue to be important to raise early childhood education and care participation for disadvantaged children. Now, when I showed you, generally levels are high. The children that are left out often are still disproportionately those from disadvantaged backgrounds who need that most, particularly among the youngest. We need to become better at identifying the factors driving the concentration of diverse children in early childhood education centers and explore policies to reduce that concentration, to distribute it more evenly across the system so that it becomes easier to manage. We need to ensure that more diverse centers are adequately resourced. Now, that's a clear, message coming from these data. We're not doing well with alignment of resources and needs. We should encourage practices that adapt to children's needs, and many countries are well on their way on this. And last but not least, support the engagement with families, with communities, cooperation with other services. This is a whole of society project, particularly in centers which have that high concentration of diverse children. And with that, I hand back to you, Mihaela.
Thank you so much, Andreas. I mean, that's a wealth of topics to discuss and to address, and we will have to be mindful with the time that we have. But I think that all the interesting findings are just allowing us to open the discussion around a few of the topics that you pointed out. I will invite everybody to read the policy brief. I mean, first the working paper and then the policy brief, because there's much more information that has been presented today. But I think what we want to discuss is how that the discussion today and everything that is in the papers are really informing relevant policy decisions at various levels. And they can be at national level, they can be at local level, but how can we really work towards increasing equity? And we've mentioned a few of the issues that are related to process quality and structure quality. So I would just now kind of take one by one, and we have like 40 minutes to discuss about three main ones. The first one that I would like us to refer to is the allocation of resources. And here we are talking about material funding, but also human resources in terms of how well prepared, even the adult-child ratio, it's one of the issues that is an important structural quality indicator, but also the preparation, how well equipped are the ones that are working with a compounding diversity. Because I think there are many interesting actually findings in there. We have to say it's 9 countries. We are not talking about the entire globe. So there are only few examples, but I think there's significance in the variation for certain aspects of quality in relation with diversity is very indicative that much is to be learned and much is to be researched further on how we can really provide policy solutions and services that are addressing diversity in an equitable way. So coming back to the issue of human and material resources, among the findings we noted, and I think some perhaps have noted about it, that greater shortages of resources are reported on centers where several dimensions of diversity apply to high shares of children. But also that the compensatory resource allocation mechanisms for early childhood education and care centers serving more diverse populations may not be in place in all the countries. I mean, the 9 countries are indicative, and it can be the case for other countries too, or such kind of measures have had limited effectiveness in participating countries. So even if they are in place, they might have not been implemented properly, or even the impact, the effect of the measure has not been measured to fine-tune the way that the policy is formulated. So coming to the resource allocation and how actually we should look at this and how we should fine-tune the way that we are perceiving the role of the policy. I'm going to ask Michel now, because you have a lot of experience in connecting what I find very important in decision-making, research and policy. And what is from your perspective, because I know that you've been involved in such type of policy informing work based on research about how the resource allocation connects as a structural quality indicator with diversity. Please, Michel.
Yes, indeed. Thank you, Mihaela. And thank you, Andreas, for this very interesting presentation. Indeed, a few years ago, we've been involved in a quite large, in an investigation in a quite large sample of locations with 400 childcare locations, where we looked at exactly at this process quality, at the levels of emotional support that the adults provide to the children, the levels of educational support, and relate that to several structural variables. And we've seen that indeed when there is a combination of disadvantages, of disadvantaged children, meaning children with diverse languages that are not known by the staff, children in poverty, children in more difficult situations, that it is indeed more challenging for the adults to provide the same level of quality in their interactions, in their daily interactions, the same level of what we call the process quality that Andreas explained. However, we also saw that when there is a slightly higher level of funding, a higher level of resources, that compensates, and that these services who have the higher level of funding, of resources, combined with a higher level of disadvantaged children, do as well or even better than the average. So it confirms that the challenge can be overcome with additional support. And that brings also another question to the fore, is that when we look, for instance, at the national analysis of all the European member states that they have done in the framework of the child guarantee, you see that in many countries it's not the national levels, but it's regional and local levels who are competent for the childcare, especially for the youngest children. And this is a good thing, because they are more closely to the population and better informed to address local needs. But the counter side is that they may be less well resourced, and that you may have the concentration of additional resources needed where exactly those resources are not available. And so it is very important that we acknowledge these regional and local municipal competences, but that they are embedded in strong national frameworks, both in resource and in quality criteria.
Yes, thank you, Michel. And I will turn now to Alejandra, because I think that she also, with her experience of working in many countries, especially in Latin America, but also beyond, you also have had experience in noting how the resource allocation may support a better quality, process quality, in addressing the needs of those that are diverse. And I think we had a discussion, and I think it's very interesting to continue on this, because we talk about dimensions of diversity and they might be confounded as disadvantages. Well, actually, we should talk about diversity in terms of richness, right? So it's how it's not equal. Diversity means disadvantage, or how actually we should turn the coin and look at diversity as a reason to enrich the act of learning and developing in a setting. So coming back to you, Alejandra, what is your point, especially in this interplay between national and local level in terms of resource allocation, and if you have had any insight from the way that the policies have been implemented across countries in Latin America, where we know that a lot of policy development has happened in this field of early childhood in the past, I would say, 10 years.
Thank you, Mihaela. Thank you, Andreas. Yes, the first thing I wanted to make that distinction that Mihaela said about the difference between diversity and disadvantage, because I think that there's a lot of research that shows that children in diverse settings will have an enriched process of learning and development. So we are not willing to have homogeneous groups. Homogeneous groups. We want to have heterogeneous group. We want to have children that learn from other people and other children that are different from themselves. So we are talking about different races, culture, religion, gender, diversity, etc. So with that said, I think that's something that we want to avoid, and something that Andreas was saying in his presentation is the accumulation of disadvantage in one classroom. And why is that? Is because we want children to be able to have a more comprehensive group interaction with children that can provide with different realities. So the challenge of disadvantaged children is that sometimes family cannot provide that much for the center, and that they can have needs that need more resources. So, for example, children that may need some assistance from special teachers, or that the families cannot provide materials, so you need more physical resources. So that there we have the challenge between what can the families and the communities get to the center, and what the center provides, and how they compensate when the families are not able to provide with those materials. Something that struck me of the working paper is that half of the centers, regardless of if they had concentration of disadvantage, they refer as lacking resources and as lacking human resources. So this is also important to notice, like the majority of the programs don't feel that they have enough materials and enough human resources to work with the children that they are working. So, and also I think that I wanted to also add that one of the recommendations was to reduce the diversity or the disadvantage of the programs, how to control for that, the number of children in one program. And I think that we have two policies that make it difficult in many countries for that to happen. One is that in many countries we have enrollment policies that target disadvantaged children. So, for example, we see in Chile, when we see the results, that most programs have a very big percentage of disadvantaged children, because that's a policy. Children have a priority if they come from disadvantaged families. So it's difficult to limit the number of disadvantaged with that when that is a priority for access. And the other is housing segregation. So we see a lot of communities that are built together because of they share some commonalities. For example, they are a Creole community in a Spanish-speaking country, for example. So I think that I would move more to compensatory policies because I think that it's difficult to change the compositions of the community most of the time. And I think also that these enrollment policies also are in favor of what Andreas was telling us at the beginning, that children from disadvantaged families benefit more from early childhood education than their wealthier peers.
And I think that we totally agree with that. I think, well, we can move forward to what is called the social mix policies, where they are trying to reduce, I would say, the concentration of compounded diversity in around specific communities, which actually is what we were talking about, exposing children to different experience throughout their learning and development. And I think that there are many countries that have tried and continue to try that kind of, I think it's a economic, political driver there to ensure that the concentration of diversity is not equaling segregation. So I think it's from all our discussion, we are agreeing on compensatory policies that are you looking for redistribution or allocating or compensating for those regions or those settings that would require additional resources. A point that I think it is important, how do we know that? And I think Michel was also pointing, who knows who needs more and for what? And I think what we, in the discussion we are having now we talked about the socially disadvantaged, but as it was mentioned, we talk about children with a different first language. We talk about children with special education or with disabilities. We talk about refugees. These are other types of costs, I would say, or they require different type of funding that is relating also to staff composition and staff capacities or competences. But I mean, I know that there is a lot to talk about. The most important thing I think that we kind of brought the attention to is that the places where there's a compounded diversity, they are perhaps better or readier to address it because they have been challenged by it. Those that have less diversity, they are still struggling or challenged by it, and they are trying to find solutions that are not yet there. And this is something that actually is worth exploring even further. And I don't know, Andreas, if you have any reaction to the discussions that has been on this topic, as we will move to the next one.
Yeah, I think the question you raised, Mihaela, is really the decisive one. Who knows what is needed and who decides on that? And I think there are two perspectives to this. First of all, and I agree with Michel very much on this, I think we can do a lot better at the system level simply by having more consistent frameworks of quality, more kind of clearer, clear societal expectations of what good quality is and how to use it. And then I think that will give a lot of guidance at local levels. And we take that for granted when it comes to schools. Schools are typically very well-defined institutions. And we know what to expect. We know how well people are paid. We have a curriculum. We have everything. And I think in the early childhood sector, we could do a lot more to ensure that we know what quality is and we know what we should be expecting from institutions. At the same time, we need to also be more adaptive to local conditions. I think Alejandra made a really important point. Maybe different from schools where you can actually redirect families. Now you have voucher systems that are actually sometimes quite effective, where people actually, send their child to a more distant school because they believe in that school. That's obviously a lot more difficult when it comes to small kids that you have to bring there and pick up and so on. So proximity of service is obviously important here. I think the answer there lies at the level of the institutions itself, and this is really where process quality comes in. The staff themselves need to be really, really good in diagnosing, what do those kids need in my center, and then the last element I have to this: how do you, bring the system and the institutional perspective together? Things like formula-based funding. We could have, financial arrangements that actually build the diversity of centers and also the level of socioeconomic advantage into the financing. That basically the resources that a center gets is proportional to its needs. Then you can still have a lot of decision making at the center, how to use those resources, how to allocate them. But you want to make it attractive for your best people to work in the most difficult centers. Now, you want to make it possible for those to address the needs of diverse children. And that ultimately is a question of resources. And I do think formula-based funding mechanisms that systematically, align resources with needs are a good way to actually make that happen.
Thank you so much. I think that we will tackle a little bit on this, and we will end up with the system view, because I think that's a good ingredient into how we are looking at how the system functions and how the funding is also allocated. The whole rationale in how much diversity is counted in the funding. Mm-hmm. But you made already good entrance for the next topic, and we will focus on the staff practices with children and attitudes, which is now more of the process quality. Actually, we are moving towards process quality. And the findings, which we have to say, they are based on if I understood correctly, is based on the leaders of the center's perception, yes, of the staff practices. And they mentioned that across the countries, the accumulation of dimensions of diversity is not as consistently associated with greater use of adaptive practices. While we saw that there were lots of blue squares there on the screen, still there is not a consistently association between them, which means that in some countries, yes, in some countries, no. And I'm pretty sure that if we would collect data across many other countries, we would have a very nice variation of consistency. However, we saw that in the findings was that the staff appeared to adapt pedagogical practices to a greater extent when working with groups with higher shares of children from diverse backgrounds. So as I was saying, the more the settings have been challenged with having to address the issue of diversity to provide quality services, the more they have been supported in providing that. Which means that the closer support has been provided, training or professional development has been invested in, or even closer monitoring of quality. However, not necessarily this is happening respecting with respect to all dimensions of diversity. So we have to be very nuanced here. In some cases it might be, but not for all children. I mean, for what we call diverse children. Well, this for me, it means that the quality practices are not always or all everywhere, or at least in the countries that have been included in the study, fundamentally sensitive or taking into account the various dimensions of diversity. And it was a question or somewhere in the chat, like, but who's defining what is quality, right? Because it is very important. So to what extent, when we say quality, we say, yeah, it should be inclusive, but is the way that we are defining quality practices and quality processes that sensitive to all this type of diversity background that we have when we are working with children? And there might be other reasons for which this is happening, but I do think that the way the quality is defined, what do we mean by quality, is one of the main ways in which it's shaping the practice. Maybe it's a question of pre-service, of in-service preparation. Is it universal preparation of professionals or a needs-based training? I saw that there's more responsive to the needs, yes? But where actually, how we should look at how diversity is embraced by those that are working in services so that they do provide quality, and we see that children are benefiting of that quality. So, Michel, what is your take? I know that this is one of the topics that you're very passionate about, and we will move to the one that is even more passion for you, the family. But what about professionals? Yes.
Yes, I think you're very right that to say that, well, of course, there are a number of issues that are common in all work with young children. This is a strong commitment to human rights, to children's rights, to values of fairness and social justice, a number of skills like understanding, being sensitive to children's needs, being responsive, knowing about scaffolding, etc. But what is often underestimated is that we also need a basic knowledge. And that knowledge may be, well, universal knowledge about children, but specific knowledge is on specific groups of children. Like, for instance, how do children grow up in or develop in a multilingual environment? And we are increasingly beyond bilingualism here, because in the cities of the world today, we are not talking about bilingualism, and we are talking about families where 2 or 3 languages are spoken, and about classrooms where maybe 10, 15 languages are spoken that are not known by the adults. So how do we support languages that we do not speak ourselves? How do we support language development in children who develop in 2, 3, 4, 5 languages? This is the reality of today. The teachers of today and of tomorrow need to have some knowledge about translanguaging and about these issues. Another aspect may be when we are dealing with children from refugee families, many of these children have experienced severe trauma. How will we deal with that? What do we know about trauma in young children and how we work with that? And what does it mean to live in poverty? There's some knowledge about that, about poverty-related issues. And so there's many examples to be given, so that there is a knowledge base that we take for granted when it is about schools, but that we underestimate when it's about very young children, and that are specific to specific target groups. How do we provide that knowledge? Well, there are different ways. I think what is, in fact, one key is the diversity of the staff itself, the diversity of the theme. So having the resources, having the experts by experience, one could say, within the team is, of course, a huge step forward. There are many examples, like the Roma assistance, for instance, in many Central European countries that are to create a dialogue. And I believe that the question you raised, Mihaela, at the end of your intervention, should it be continuous professional development, needs-based? Should it be initial education? It's obvious it's not an either-or question, of course. We need there are many ways to achieve, to get this knowledge, to get skills, to get what is needed, the competences that are needed. But initial training is a very important one because it forms a basis on which continuous professional development can build. And we know that what increases quality in any context, but especially also in context of diversity, is this cycle of observation, analyzing what one has observed, discussing it with the colleagues or with the supervision, reflect about it and take action from that reflection, and having that circle continuously renewed, which again will bring us to a question of resources, of course, because that needs supervision and that needs time. And so that is also a question of resources.
Thank you, Michel. I'm looking now at Alejandra. So, what is your your opinion, or from your experience again, connecting research with policies, universal knowledge and skills, specialized knowledge and skills by addressing diversity? Should that be like both of them? I mean, again, pre-service, in-service, how? Because we talk about process, how do we get from investing, equipping, to really seeing in practice that things are happening? What is your view from what you have seen, where investment has been, or know-how has been there, or the quality by just monitoring and having a feedback is really nurturing the quality improvement to address better diversity?
Thanks. First of all, I must say that I agree with with Michel. I think that first, I mean, initial training is critical, is where you set all the foundation and where all these like common knowledge and development of skills that teachers need, of child development, children's rights, etc. I think that is very it's basic, and every teacher needs to know that in order to start teaching and being able to interact with one child and being able to understand their needs and respond. I think that there's also some more specific knowledge. This is the knowledge that it depends where you live and the challenges that you're going to face, and those, as the world is changing, is very difficult to anticipate and to put everything in initial training, because, as for example, in Chile 20, 30 years ago, we didn't have migrants that spoke another language. So we didn't have that issue in early childhood education, that teachers would need to learn how to work with children that were bilingual. Now we have a huge migrations of people from Haiti, and teachers need to be taught and train how to work with multilingual families. So I think it's not either or, but I think also something that I've seen in the ground is that many teachers challenge adapting the curriculum and their work to individual children's needs, so that they somehow freeze and they say, no, but I don't know how to work with children's special needs, so I do need this training, and at this moment I cannot do anything because I haven't been trained. And I think that a lot of the adaptation has to do with what Michel was saying before, being able to observe children, observe your practice, get feedback, working with other colleagues. So I think that there's some part of that that's knowledge-based. Another one that is developing skills like observation and being able to adapt the curriculum to children's different needs. We see in Latin America a lot of scripted curriculum, more so in poor countries, but we don't see teachers equipped to adapt that. So we see a teacher, I've seen teachers teaching children numbers, or all the children in the same way with children that have language, others that don't have languages. So that's where you see that they require these initial skills that are the core of teaching, and it's about learning how children learn and how that they can adapt to their needs.
And I think that's what the study was pointing to, adaptive practices. So how well equipped they are to know what is quality practice in general, but how that resonates in context in which you have different needs, specific needs that are to be addressed due to the richness of diversity of the group of children that you have in your classroom. Andreas, would you like to add something at this point related to this issue?
Yeah, I fully acknowledge the issues that, both Michel and Alejandra have laid out, but actually I think we could do a lot better on data systems. I think most of the issues we are talking about here are actually quite easy to observe, quite easy to measure, quite easy to capture. We could just aggregate them. I think there is a lot that we could do in addressing those issues by simply capturing the environment, the socioeconomic conditions, the environment of early childhood education better. And then, of course, the second question is, how do you prepare for that? And I very much agree with Alejandra that, you cannot prepare yourself for all eventualities years in advance. Our world is changing, but what you can do is to prepare people to advance in their careers and to put a much stronger emphasis on continued professional development. Maybe, in initial education, you can put the foundations. And you also, I think, can put more emphasis on an inquiry mindset that actually teaches enter centers with the intention, well, I'm actually not just here to implement, curriculum, but I'm here to design, adapt, evolve that curriculum. I think that's what you can achieve in initial training. But we need to realize it just needs to be a lot more emphasis on continued professional development. There needs to be more a kind of, team approach to this, strong professional learning communities where teachers work together to frame good practice, analyze good practice, share good practice. Now, the best ideas usually don't fall from the sky. They don't come from the government. They're actually found in institutional settings. And the more we become better, we become to, identify and scale and share those kinds of practices, the stronger education systems become. So actually, I think there are many policy levers to strengthen professional practice. This is what we are talking about here, to move away from, just implementing, prefabricated things that will not work 10 years down the road, but to create a more dynamic profession. The most positive aspect from our study, I actually see in the willingness and the ability of teachers to actually adapt. When you see that in more diverse settings, there seems to be a greater propensity to adapt pedagogy. That's a very positive sign that shows that actually teachers, are in one way responsive. But if systems can equip them better, I think we can do everything. And that also, is my take on your question, should it be universal or specific? I think it's a really good question. But I think, you set universal foundations and then equip people to advance on the specifics in their context.
Exactly. I think that was the main point, and we are parking another coin of thoughts for the system view level that we will address later. Because I think what you were mentioning, Andreas, is it is indeed true what you have mentioned in the findings, that there is a will, but not only. There is a lot of commitment, responsibility that is taken by professionals, and they are equipped, but there are many challenges that perhaps not even us in this room and not all of us now in the webinar would have, answers to. So how do we actually create that kind of conditions for iterative reflection and co-constructing solutions for challenges that are each of the professionals in their context encountering? And that's perhaps the most sustainable way to addressing current and future challenges. As much as we would like to discuss more about this, we need to move to the next topic, and that's related to engagement with families, communities, and other services. And again, among the findings was mentioned that there is a strong negative association with levels of parental involvement in ECEC activities, especially in centers with high shares of economically disadvantaged children and of children with different first languages, and in centers with several dimensions of diversity accumulate. This is possibly in connection to less effective center level practices to engage families. So meaning that there are centers that still do not know how to approach families that are having a different, a diverse background. Well, interestingly, at the same time, it was mentioned in the brief that ECEC centers with different dimensions of diversity apply to a high share of children, and especially those with several dimensions accumulate, report more frequent cooperation with child, family, or social services, for instance, with child protective agencies or family support services, but not necessarily with communities and neighborhoods. So on one hand, there is less involvement, involvement or parental involvement. On the other hand, services are collaborating more with other types of services. So there are two important ingredients in this discussion. So it would be interesting to hear what your perspectives are, especially in what regards family engagement. How you would comment on this? I know this is at the core, at the heart of your work, Michel, on how we address, how we involve, how we engage with families that are belonging to have diverse background, or belong to different groups in our society. So, what is again your take on this and your experience, and also what came out of the research that you've been carrying out for many years so far?
It is, in my view, one of the more challenging conclusions of the report that is presented today, that many services experience that they find that it's more difficult to involve parents when they have higher degrees of confounded forms of diversity. And first thing is we need to take into account that that parents may have very different reasons very different ways to participate, or different ways to express their commitment or reasons to participate. Some parents have themselves very bad experiences as a child in services. Some are more or less familiar with the often implicit rules of what participation is, especially when it's about formal forms of participation, such as organized parent meetings and things like that. We could refer to notions like cultural capital and social capital. That is let's say that the meetings are often related to the kind of social and cultural capital that teachers have, and that might be distant or not distant from certain parents. Some parents may have more deference to teachers, and out of respect think that maybe it's better not to involve too much. So there's all these reasons, and that make that parents participate more or less, and that is in fact not a correct expression. One would have to say that the way parents are committed is more or less visible for teachers. Could be a better explanation. And what I think is very important in such contexts of diversity to see is that there is no one size fits all in parent participation. So there is no one solution. The solution is the answer to diversity is diversity. We need diversity of approaches. It's not because some parents do not attend the meeting that we should stop having the meetings. Rather, we should complement the meetings with other ways of participation, some more formal, some more informal, some more grouped, some more individual. And there's no one size fits all. So I think that is the most important. The question is not with what method do we reach all parents. The question is with what methods in plural do we need to reach each parent, which is an entirely different question.
I wonder, and this is a question that it can be addressed to all. I wonder, however, if coming back to the definition of quality, perhaps in what we define ECEC, perhaps families or the family involvement and collaboration with family, perhaps it's not given the central role that it should have. Perhaps when we say that a quality ECEC is, you can consider it of quality if there are many other things that are not necessarily related with families. There is always something that is related to family involvement, but it's not seen as a central element of quality definition. Maybe it's the weight is not that much put on family involvement and family participation in decision making. I'm just wondering. I mean, I'm just putting it on the table because I know for decades this is an issue. And we are not talking about children now, we're talking about families with a diverse background, you know, in all these 4 dimensions, and we can add other dimensions of diversity. The question, it has been there for a long, long time. And I think it's the same for school education, not only for early years. And you expect that in early years, parents are more involved. There's still this issue on the table. I'm wondering why we keep it. And we talk about professionals not being well equipped, you know, maybe they don't know how. Is it that the ECEC is looking more inward than outward? You know, it's more focused what happens in the service rather than how the service is communicating with the community where it functions. It's a question for all of us, because it's a recurrent issue. And I'm still wondering, why is that? Majority of those that work in services are parents themselves. So they know how it is to be a parent. So I think it's a very, especially when we are talking about populations that are different or for various reasons. What is your view on this?
Thank you. First of all, you know, I think one of the most worrying indicators that we have in the OECD is that parental engagement has actually declined over the last years. You know, there is a perception that parents become more active, but actually, if you look at the data, I can only say that about the schooling sector, but we have very clear indications that actually we see an increasing trend towards commodifying education. You know, children are, you know, consumers of some content, the teachers are some kind of service providers, and parents are kind of client. And we have created a distance between different stakeholders that in the past didn't exist. In the past, you know, early childhood education and care was a kind of center of a community. Everybody participated, a whole of society enterprise. And actually, we're seeing growing distance. And I think this is a concern because, you know, the idea that early childhood education and care can compensate what doesn't come from families is fairly naive. Actually, all of the evidence points to the opposite. You cannot make, you know, compensate what doesn't come. The only answer is to bring parents into the equation, to actually very actively engage them in the world. And it's so interesting from our survey how different parents or even centers in different countries respond to that. You know, when you compare, for example, I think the most extreme in our survey was the responses from Norwegian and parents in Israel. You know, in Norway, many staff in the center said, I cannot possibly interfere, you know, with the wishes of parents. You know, it's not my job, it's not my role, and it's not appropriate for me to tell parents about, you know, parenting and questions about education. In Israel, the attitude was totally different. You know, the teachers would tell you, well, you know, if the children play up to midnight with their mobile phones, I can't do any work next day. So it's my job. I have to help those parents to become part of this. And I think we need to find, you know, and I mean, Michel made that point really well. You know, we need to not have a one-size-fits-all approach, but we need to find more, you know, flexible ways and more differentiated ways to engage parents into this equation. Where we do not succeed, don't expect that you compensate for the lack of that influence. I mean, that simply will not work. The last point I want to make on this is technology. I was actually over the weekend in Saudi Arabia. That's not a country that you would associate with early childhood education and care. It's actually really, really hard for the government to reach families because there's a general mistrust towards institutions for small kids. You know, parents want to keep their kids with them and so on. And one of the things they did really well, and starting in the pandemic, was to provide parents with much better resources themselves. As parents, you know, you have now access to digital environments that tell you about, you know, what do children actually do in the centers? How do they learn? And so you have a much more informed kind of way to engage with the center. You know, often if the center is a black box to you, you talk now and then to someone in the center. That's not a way how you can actually build a kind of sustained relationship. You need to know what's happening there about your child. And I think technology provides us really with very, very good means these days to create stronger bridges between what's happening in the family and what's happening in the center.
thank you, Andreas. I'm wondering also about Alejandra's perspective. Yes, I was waiting for. Thanks. I do think, yes, coming back to the bringing perhaps the parental involvement, but also the collaboration, communication, and collaboration with families as a central point in quality definition. With all the bridges that we can bring, with the build with technology or by equipping professionals and so on. I'm still wondering if enough attention is paid to that as being crucial, essential, because then you can find it later on, or you can continue that kind of relationship of collaboration.
Yeah, I want to follow up on something that Andrea said. The cultural diversity, but also the fear. I think that teachers in many countries have had the experience that they fear families. So that at the end, there's a lot of resistance to include families. So, for example, in El Salvador, the country as a policy banned having these notebooks that children would need to write when they were very young at age 3, but the teachers then would buy them themselves because they said because that's what parents want us to do. So even though the country had a policy and were changing their curriculum, teachers were very frightened that the parents wouldn't take the children because they were thinking that they were not learning. And that experience, I've seen it in many other countries, in Chile, in Azerbaijan, that the teachers feel that if they don't show parents that the children are acquiring skill and knowledge, they're not going to validate them. So sometimes that's why they close the doors. So they have only one, the activity, but they don't see parental involvement in a more deep way, in a more profound way. So we see really little programs that have a parent council, that they make decisions, that they participate. So I think that that's something from the center. And at the policy level, I've seen countries that they have include parents in the quality definition, they're working with parent involvement and engagement at different levels. And also not only that, but also in assessing the quality of the program. So, for example, in Sweden, they do have part of the quality assurance programs, they invite parents to participate. Last year, we started piloting in Chile the quality assurance system, and they also ask parents to participate, not in a satisfactory survey, because we know that most of them are very narrow, and most of them are very positive because parents actually are not aware of what happens in the center, but more like conversation, focus group, so that parents can get to know what happened in the programs and then are able to assess the program. So I think that we might be moving towards that in some countries, to include parents and to understand. I think the pandemic was a great, we all learned a lot that we couldn't do it without the parents. In early childhood education, I think that we realized that parents, we couldn't teach the children if they were at home, if parents were not completely and with the idea and working with them. So I have a positive feeling, but I think that there's a lot of resistance and a lot of fear from the centers.
It can be mutual. I mean, for certain categories of parents, I think that trust is also an issue when working with the early childhood education and care centers. I mean, there could be many barriers there. What I brought into the discussion is that I think that this whole component, while it's being very problematic and challenging, it has perhaps not yet been put at the center of defining quality for, especially because of children. So it's adults working in centers and adults being at home with children, parents and professionals. They owe this to children. They need to work together because they are both responsible for the well-being of children. And I think that's the part that, in terms of defining quality, is not very well articulated, how that is created, not how comfortable parents feel or how comfortable professionals feel, but how that is really beneficial for children and how they have to work together. ethically, it should be also a reason for trying to find ways of doing it. Well, we are moving towards the last topic to discuss, and I have kind of screened a little bit the chat section where a lot of comments are there, and I think I'm very thankful for colleagues that they have this reflections during our discussions, with some of them quite interesting. And we're moving towards the system view, because it was pointed out in the last findings that was related to families that when in centers with compounded diversity, they are more, let's say, propense to work with other services, especially social services. So they were reaching out and looking at how they can collaborate to address specific challenges related to the way that they would work with families. And that brings to the more system view, because it seems that there are countries that are managing to consider diversity as an important ingredient in the way that the system is organized. And I'm talking an ecosystem here, where early childhood education and care is one type of service among other types of services that are targeting young children and families. And especially when we talk about diverse families. So refugee children and families, children with special educational needs or special needs or developmental delays. So they also are a special categories. Children that have a different families also that have a different first language. So all these categories of diverse populations, they do they ask actually for a definition of how they should be considered in the way that the system is set up, in the way the policies are formulated. The question now is the system ready to address those diversities, and what actually we should look for so that it is capable of providing that. And when I say ecosystem, it's not just ECEC, it's in general. And that points to the collaboration with other services or the networking across services. Because we might not have solutions for all the problems, but obviously, and now we go back to the discussion about resource allocation. If diversity is not a variable, a complex one that is to be considered in the way that system policies, national or local, are defined, then it will be very hard to come to more equitable service provision. So, Michel, we talked about the material, immaterial needs of vulnerable families, yes, and how. Do you have an example of how this can work, at least in, I don't know, at local level, if not at national level? Can it be done? Because I think we have 9 countries in this study, and there are hundreds of countries around the world. Maybe there could be some more example that we can learn from.
Yes, indeed, and I think there's increasing in many parts of the world. It's increasing the acknowledgement that if we want to give every child a fair chance in life and leveling the playing field, we need to urgently open up the doors of the early childhood sector and considering as a part of a larger whole. And then I do not just refer to parent support services or whatsoever. I refer to the combination of immaterial support, such as educational support, and material support, such as housing. We are beyond the dichotomous question whether we should read to the children or give them a roof over their head. I mean, both are necessary. And what I think is very promising is these new kind of initiatives that relate that sectors that traditionally are very different. Like, for instance, in the city where I happen to live and work in Ghent, you have the welfare department that moves its offices from the city hall to the childcare center, because that's where children are and where families come and they have a trustful relationship. So this is where they can hook on. We see it It was also the case in what were the Shore Start centers in England. So this relation between material support aspects such as housing, welfare, training for unemployed people that are related to childcare, and that the dynamic and the synergy that can emerge by the collaboration between these very different types of professionals. I think this is where we need to go to if we want to provide to level the playing field.
Thank you, Michel. Alejandra or Andreas, what's your also perspective into systems readiness? How do we build that kind of system readiness? Or what is the next step towards building that system readiness to address diversity? Is it a question of how we define early childhood education and care services within the ecosystem, their role? Is it about how we define children, family across policies, across sectors, and their well-being, taking into consideration the diversity that exists among themselves? Should we have an effective interplay or efficient interplay between local and national policies and frameworks? So there are lots of questions in the air. The thing is that all countries are performing differently. And the question is it because they are acknowledging or they have not actually taken into account enough the diversity of the population, of the needs in their own countries? And then we are talking about that in the context of child development at early years and families' needs and responsibilities in children's early years.
I think we're actually still quite far from any systems perspective in the early childhood sector. I think we still have a patchwork of institutions. We have a quite weak regulatory environment for all of this in an area where actually it would need to be strongest. Older children can articulate themselves quite well. The youngest cannot. And I think that there we need a lot more kind of guidance and structure in this. So I think the more we build systems, the more I think those systems will raise their profile, and we will also encourage and build awareness. For me, this is really, I think, an area where public policy still has a long way to go to make this, and also, to facilitate the transition from care to education and from access to quality, I think. But studies like this make a start, and as you rightly say, they cover a limited range of countries. We need to know a lot more about many other countries. But I think the more we create a language around this, make it visible, I think the better we will be prepared to respond to this systemically.
Indeed, and I think that's what this discussion also is contributing to. And I do agree with you that perhaps we're in the early years of really building an ecosystem that serves our young children and their families. I think that a lot of work has been done in different sectors, but I think that bringing the whole system perspective that is focused on child and family, I think this is something that we are still elaborating on across countries. What is your opinion, Alejandra? I know that there are some countries in Latin America that are talking about an early childhood strategy at the country level that brings together all sectors and trying to articulate a good coordination at the national level, which I think is very challenging, but brings that kind of ecosystem perspective.
Yes. I think, in Latin America, there are many countries that have started, at least Chile is the one that has the policy for more years. That's already more than 10 years. Colombia also has, República Dominicana, and others are building different plans and not necessary policies that are integrated policies that see the child as and the family as a center, and they try to offer services to cover their needs, starting from pregnancy, and also, as Michel was saying, not only services but also housing and work and healthcare and vaccination. So the idea is that the family is seen like a whole and that they can be connected to different services. It has not been easy. It has not been always been successful and in all countries, but a lot of progress has been made, I think, in the last 10 years. And also it's a mindset. From the early childhood director, they know that they work with the healthcare center and that they don't receive a child if it doesn't have the vaccination, and they know where to send the family when they are unemployed. So it's something of creating a support system that I think that can contribute to a more equitable society, because this system target disadvantaged children get access to more benefits. So I think that early childhood is one piece of this comprehensive system, a very key one, but it requires all these other services as well.
Thank you so much. Unfortunately, our time actually has ended, and while we can see that we can continue having a very passionate discussion and committed to bringing a lot of thinking across all the themes that we've addressed today, this is just a kind invitation to all those who participated to read the working paper, to read the policy brief, but perhaps more important, that we continue the discussion in the countries where we are working with the experts, connecting policy with research, so that we can really get into figuring out how we can bring a quality in close connection with diversity, process and structural quality in closer connection with diversity, making diversity as the asset that we have in the population we are serving through the services, so that we reach more equity. We thank you so much. Well, first of all, thank you to our speakers that have participated in the discussion today. And we are closing this webinar with the hope that the discussions in the countries, across countries, around process and quality, structural quality will continue. We also would like to invite you to continue such discussion during our conference, ISSA conference in October 2024 in Sofia. We are going to talk about the fact that it takes an early childhood ecosystem for all our children to thrive. And I think that's what we aim to do, as we were just saying. We need to have perhaps more discussions about who is this ecosystem and how it's really supporting all children, and how we are contributing, each of us, I mean, what is needed, or to what we are contributing, or what changes we are asking to happen, so that we bring a closer dialogue between research, policy, and practice, with the ultimate purpose actually of protecting and asserting a healthy, happy, and generative childhoods for all children. We thank you so much for your time today, and we hope to see you, if not in Sofia, on another webinar or with another occasion. Huge thanks to Andreas, Alejandra, and Michel, and a good rest of the day for all of you. Thanks you.